Let's move now to COVID testing backlogs and proposed testing strategies outside hospital settings. Well, there's suggestions they could be compromising our fight against COVID-19. It's a concern of frontline clinicians and public health specialists at the very forefront of this crisis. And for more on this, I'm joined by Professor Francois Venter. He's from Wits University's Reproductive Health and HIV Institute. Good evening, Prof. Thank you very much for joining us. Just explain to us what do we need to change about our testing strategy?
So the reason to test is to do something with that test. And at the moment, the lockdown was there to protect our healthcare resources, our hospitals, our clinics. It was to prepare, to blunt the curve, to make sure that we didn't overwhelm everything. For that to happen, we need to have testing inside the hospitals that turns around very, very quickly, so that people who are suspected of having COVID, we can isolate them and we can quickly tell whether or not they don't have it. Also for healthcare workers, that we can return them to work or keep them away from work if they are positive. What we're seeing at the moment is this overwhelming of the testing system by community-based testing, which is threatening our hospitals and our clinics directly in terms of the services they need to be providing.
All right, so how exactly, who should be getting tested and who shouldn't be getting tested? Let's take me, for example. Let's say I wake up with a really sore throat and a bit of a cough, and I phone my employer and I say, look, I don't think I should come into work because I might have COVID, I feel weird. The only way to confirm that and for my company to make a decision about whether to put the whole newsroom in lockdown and isolate is for a positive test. Are you saying those shouldn't happen?
No, they should happen, but if your test is being done and somebody who's in an ICU in a quarantine area is waiting for a test because you're having it done, that could mean that was a poor use of your resources. And at the moment, we have precious few tests in this country. We have to prioritize. It certainly would be great if we could test everyone with a symptom. It would be great to be doing hotspot analysis. It would be great going into the community. But those are really, honestly, at this point, nice to have. Our hospitals are completely hamstrung by the slow turnaround times, by these massive community programs. Everyone with a sore throat is going forward. You know, I get that people want to do these things, but we're seeing incoherent responses from the Minister of Sport or from the Minister of Labour in terms of this. There are intelligent ways to deal with it. And what you don't do is just have these blanket testing policies without acknowledging the reality of the fact that we're not on top of our testing backlog.
So how do we create that priority? Because it makes perfect sense that someone like me could wait, but someone at the front lines or in ICU must not wait. How do we create that priority, and whose job is it to put that protocol in place?
So the Department of Health should be doing this. They should be implementing. They should have been implementing it 4 weeks ago, to be quite honest. We've been complaining about this capacity, and we knew it was coming. We kept being reassured that we had sufficient testing capacity, and we knew that it was unlikely to be true. So in many ways, you know, we've had quite a while to get this together. Those priority settings are in place. They have been presented to the Department of Health, and they need to be implemented very quickly. And it's not that hard. You start with your ICUs, you start with your hospitals, you start with your healthcare workers. Then you move to people who are highly likely to have it, who are outpatients like yourself with a sore throat at work. There are ways to grade that depending on how many tests you can run. At this point, we're not even getting to the hospitals, let alone to more ambitious programs beyond that.
So I'm a little confused. You say it's up to the Department of Health. I interviewed Professor Salim Abdul Karim, who completely agreed that testing needs to be prioritised. So who exactly, how is this created? How is this priority? Is it about a communication to say this test must be marked as non-urgent? Exactly how will it work?
So the testing strategy, I'm not quite clear who's been advising government on this. You know, I'm part of the Ministerial Advisory Committee. I don't know who came up with these massively ambitious programs in the absence of having the capacity there in the first place. If your turnaround time on these tests is more than 4 days, and we're hearing reports of it being over 2 to 3 weeks, you might as well not have done the test. It's just a complete waste of money. So I don't know who came up with this in the first place. At the moment, what I think the minister should be doing is issuing a decree to say only hospital-based patients and healthcare workers should be getting first, should be first in the queue. And it's politically difficult to say, but you know, we should be these 50, 60,000 tests at each laboratory we're seeing, these huge mountains of tests that haven't been run yet, that unfortunately just have to be thrown away. If you can't do that quickly and efficiently and get the result back to the person it's pointless. It's like doing a pregnancy test a year after pulling it. You know, there is no absolute point to doing this.
Tell us how dire is the shortage of test kits? We know that we're short of kits, but do you have any understanding of how many we've got left in the country and when we're getting more?
It waxes and it wanes. You know, we're competing on the international markets, and the government doesn't have full control over the situation. It's not entirely clear who is being prioritised and under what conditions. WHO is fighting to try and work it out. But we are going to be competing. We're going to be competing for quite a few months and possibly even years to come. So getting this priority setting is going to be important. So maybe we have a little bit extra for next month, and then maybe we start prioritising, you know, symptomatic people in the clinics or people in high stakes workplaces, in old age homes, places like that where there really are high stakes. What you don't do is you don't start testing healthy athletes to see if they're going to go back to work, which actually makes absolutely no sense anyway. I do worry that the ministers don't seem to be talking to each other, because some of the recommendations coming at the moment are just patently absurd.
Well, thank you very much. That was Professor Francois Venter from the Wits University's Reproductive Health and HIV Institute. He's also part of the Ministerial Advisory Committee on COVID-19.